90% of physicians experienced some sort of politicization. And that had to do with discussions with patients who may have resisted wearing masks, who may have been requesting medical treatment that wasn't recommended, or who might have been refusing vaccination. If physicians had experienced this kind of politicization, they were twice as likely to experience conflicting professional emotions. I'm Dr. Christine Sinsky, the Vice President of Professional Satisfaction at the American Medical Association. And today I'll be talking about a paper that will be in an upcoming issue of the Mayo Clinic Proceedings. The paper is The Politicization of Medical Care, Burnout, and Professionally Conflicting Emotions Among Physicians During the COVID-19 Pandemic. Why did we do this study? Well, in the first year of the pandemic, physicians were approached as heroes. Physicians and other healthcare professionals were approached as heroes. But by the end of the second year of the pandemic, it appeared that political messaging was influencing many patients' medical decision-making to a degree that most physicians had never previously experienced in their careers. We believed that physicians were facing a new source of stress and a level of stress in caring for their patients that they hadn't experienced in the past, with this intrusion of political messaging into the medical decision-making process for their patients. Physicians are trained to care for their patients with compassion and without judgment for how the patients themselves might have contributed to their illness. For example, when treating a patient with lung cancer related to tobacco abuse, physicians are trained to address them with compassion and understanding. Toward the end of the second year of the pandemic, the majority of people who were hospitalized, and particularly the majority of people who were critically ill in the intensive care unit with COVID-19, were unvaccinated. Many of the physicians caring for these patients were working incredibly long hours, longer hours than usual, not taking vacation, making personal sacrifices. Many of these physicians had lost colleagues to COVID over the previous year, and some were taking personal risk in caring for patients with a condition that now, to a large extent, was avoidable had the patients themselves chosen to be vaccinated. So we wanted to explore the role that politicization of medical care had in physicians' practices and the degree to which that politicization might cause some professionally conflicting emotions. So what we did, we surveyed a nationally representative sample of 3,000 physicians who were in 4 specialty groups. We chose groups that were COVID-facing. So our specialty groups included emergency medicine, critical care, hospitalist medicine, and those in ambulatory practice who were also likely to be COVID-facing, general internal medicine, family medicine, and pulmonary, primarily outpatient. Hospital-based pulmonary physicians were included either in our hospitalist group or in the critical care group, depending on the nature of their hospital practice. These 3,000 physicians were surveyed in a 2-month period, December of 2021 and January of 2022. We found that the vast majority, 92% of physicians, were experiencing some stress in their medical practice related to the politicization of medical care. 2/3 of the physicians surveyed reported that they were working longer hours due to the impact of COVID-19. 3/4 of physicians reported burnout. 1 out of every 2 physicians reported moral distress, and if a physician did experience moral distress, they had a 3-fold higher odds of experiencing burnout. 1 out of 5 physicians experienced compromised integrity in the course of their work. And if a physician had experienced compromised integrity, then they had a 3-fold higher odds of experiencing burnout. 56% of physicians experienced a feeling of lower empathy toward patients who had not been vaccinated and were affected by COVID-19. Nearly 50% felt a higher level of resentment toward patients who had not been vaccinated, and about 40% felt higher levels of anger toward patients who had not been vaccinated. Now, finding these high levels of professionally conflicting emotions does not mean that physicians acted upon that, but it does speak to the tension that physicians felt, that these normal human reactions were in conflict with their professional aspirations and their professional training. And they had to hold that tension in the course of their care of patients. We believe that physicians strive to treat patients in ways that are consistent with their professional values, even when under stress. Physicians are trained to care for patients, as I mentioned earlier, without judgment for the choices they made that may have contributed to the illness. So even though these conflicting feelings and moral distress can be considered normal human reactions in healthcare workers in response to preventable sources of work overload, stress, sickness, and death, we haven't trained physicians in how to deal with this. Educators might benefit from our findings by helping developing physicians understand that political factors can influence their feelings. And they can use that understanding to help to create the space for intentional, professionally practiced responses so that we can live up to our aspirations to provide our patients with compassionate care, no matter how they came to need our help, how they came to the conditions from which they are now suffering. So I encourage you to read the article that will be in the November issue of the Mayo Clinic Proceedings.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.